Good afternoon, everyone. My name is Amy McCallion, and I'm the chair of the Alzheimer Society of BC's Board of Directors. Welcome to today's event, Conversations That Matter, Aging with Choice. Before we begin, I'd just like to acknowledge that the Alzheimer Society of BC operates on the traditional, ancestral, and unceded territories of Indigenous peoples around the province. Our provincial office is located in the territories of the Musqueam, Squamish, and Tsleil-Waututh peoples, with regional resource centers located on traditional territories in all regions of BC. Our vision is a world without Alzheimer's disease and other dementias, and that world begins with a more dementia-friendly society where people affected by dementia are acknowledged, supported, and included. This vision is only possible through ensuring that everyone living on these territories has access to support that is culturally safe, barrier-free, and free from Indigenous specific or any type of racism. Today's event is part of Alzheimer's Awareness Month, recognized across the country each January. Alzheimer's Awareness Month is an invaluable opportunity for us to have important conversations about issues that are relevant to families affected by dementia. It's great to see so many people joining us from around the province today. And to get us started, I'd like to hand things over to our host and moderator for the day, Alzheimer Society of BC CEO, Jen Lyle. Over to you, Jen.
Thank you, Amy, and welcome everybody. We'll let you all get settled in, hopefully with perhaps a warm cup of tea or perhaps a warm cup of coffee on what is probably a little bit of a cold day. I've heard that there's some pretty wicked snowstorms happening across the province today too, so welcome. Before we get started, I'd also like to say a thank you to Wavefront Center for Communication Accessibility for providing enclosed captioning for today's event. As Amy noted in her opening remarks, Alzheimer's Awareness Month is an important time to shine a spotlight on the challenges families affected by dementia face. And with more than 85,000 people currently living with dementia in this province, it's vital that we have supports in place so that they can age with choice. Today, we're discussing the issues related to ensuring that people with lived experience are able to age in a way that best aligns with their values and needs, or more simply put, that they can age with choice. Today, we're joined by our panelists, Isobel Mackenzie, British Columbia's Seniors Advocate. She has over 20 years experience working with seniors in home care, licensed care, community services, and volunteer services. Isobel led BC's largest not-for-profit agency, serving over 6,000 seniors annually. In this work, she led the implementation of a new model of dementia care that has become a national best practice. We're also joined by Jim Mann, an advocate who is living with dementia. Jim is a retired marketing and communications professional from Surrey who's been a longtime supporter and volunteer with the Society, along with many other initiatives. Jim was first diagnosed with young onset dementia at the age of 58 and has been on a mission to make life better for others affected by the disease ever since. And finally, we're also joined today by Jana Schulz. She's an advocate and caregiver in Cranbrook. In addition to her personal experience of the dementia journey, Jana is also a social worker and regional dementia education coordinator for the East Kootenays, as well as an elected official within the Métis Nation of BC. Jana's father, Roy, is living with mixed dementia, specifically Alzheimer's disease and vascular dementia. Before we get started, I want to encourage everyone to use the chat box throughout the event to share your experiences, your reactions, and your questions. We're going to do our best to make sure that we leave some time towards the end so that we can have our panelists respond to some of the comments that you leave in the chat box. So do feel free to use that throughout the course of today's discussion. So to start it off, I preface this with this is a discussion about aging with choice. But I'd like to start us off with that question of what does aging with choice mean to you? And why do you think it's important? So Jana, I'm going to start with you first. What does aging in choice mean with you and why is that important?
Thank you, Jen. First of all, I just want to acknowledge with gratitude that I'm joining in from the ancestral, traditional, and unceded territory of the Ktunaxa Nation today. Aging with choice means to me that we should be able to live where we feel that we can be best supported, whether that be in your home, long-term care, assisted living, independent living, with family, etc. That we will have the choice to access service that honors our individual needs as we age, having equitable access to support services that are culturally safe regardless of income. Aging with choice impacts me in many ways. Personally impacts me because we start aging the moment we are born. And just like our uniqueness to one another, our needs require supports that are not using a one-size-fits-all approach. This approach leaves rooms for gaps in accessing the best suited services to our needs. This can create additional layers of complexity to anything impacting our spiritual, emotional, mental, and physical needs. When my dad was requiring the next step to care, we had choices, but there was a risk that those potential choices were not ideal to maintaining quality of life, not only for my dad, but for my mom and me as well. Basically, our available choices became a this or that type choice. Despite neither being ideal at the time, we had to make a decision, and we had to make one quick. Thankfully, we made the right choice. As my dad is thriving, considering how far he has progressed in his dementia journey, this unfortunately is not the situation for many. Thanks.
Thank you so much for that, Jana, and for sharing your personal experience with regards to that. I'd like to ask the same question to you, Isobel, in terms of what does aging with choice mean to you, and why do you think it's important?
Well, I think it would echo many of the things that that Jana has said. I think that, regardless of whether we're 25, 45, 85, or 95, we want to be able to live where we want to live, with whom we want to live with, and how we want to live. That's the only thing we all have in common. Where that is, who that is, and how that is as different amongst people in the ages of 85 and 95 as it is at 25 and 45. I think that one of the challenges, however, that we are going to have to come to grips with is that in those choices, we also have to accept that I get to choose how much risk I want to live with. So we don't have an issue accepting your right to live at risk in your younger years, whether you want to do extreme sports or occupations you might choose, or things you want to do that are high risk behaviors, relatively speaking. And as we age, those of us who have throughout our life craved comfort and security and certainty and have been cautious, that's probably not going to change. And how we look at having ourselves supported as we age is going to look one way. But if we've been somebody who throughout our life have embraced challenges, have sought out exploration and opportunity and risk and uncertainty and thrive in the chaos of things, that's also not necessarily going to change as we age. And so we have to accept that while people may not make the choices that we think are best for them, it's honoring the fact that you don't lose the right to make those choices. And it's very challenging. It is especially challenging for family members. It can be particularly challenging for clinicians. But really, when we think about, the choices, it really is free choice. And that's what defines us as human beings. That's what makes us unique individuals. Every day we make these little micro choices, and that defines who we are. And as we age, we need to be careful that we aren't surrendering those choices to other people to make for us. Unfortunately, for some, that will be the reality, and that actually will be the necessity. We just want to make sure we don't make it that way either prematurely or unnecessarily.
Well, thanks for that insight, Isobel. And one of the common threads that I'm hearing between both you and Jana is really the importance of recognizing that it's defining a person's journey as they define it in a way that's meaningful for them, aligns with their values, their culture, their needs. And I hear your point around making sure that we collectively aren't making those choices for people. Jim, same question to you. aging with choice. What does it mean and why is it important to you?
For me, aging with choice is great, is ideal even for some people. That requires a lot of forethought, self-reflection, and honesty. And I applaud those who want to age with choice, age in place, and who do it successfully. I view this issue with some healthy skepticism. We know reinforced messaging from advertisements influences people's buying habits. Some individuals may have grown up with a particular brand of toothpaste, which is the same they buy today. But repeatedly seeing and hearing about the benefits of another brand may convince them to change. Likewise, I wonder if the messaging from government and others that everybody wants to live at home will be that subtle message that makes some reconsider a move to independent living, perhaps. A fellow in my support group, I will call Chuck, helped me understand his reality, and I'm sure the reality of many others. He and his wife were living in the basement suite of a home that was owned and occupied by their daughter, son-in-law, and their 2 children. About a year after his wife died, Chuck realized his world had shrunk. His daughter and son-in-law were at work during the day. Their 2 children were both at school. Chuck was left at home, not really knowing what to do, and with his Alzheimer's, feeling unable to venture far outside his home. So he watched a lot of television, alone. There was no or very little socialization. And one day it hit him that this was not sustainable for his own health. He needed to move, to be around people. At first, he seemed hesitant to tell us. He finally did when he was on the brink of moving. And while none of us probed why he was hesitant to tell us, I've always wondered if he felt he was going against the norm because of the everyone wants to age in place messaging he was hearing. Aging in place may be economically beneficial from the government's perspective, but there is more to it than simply adapting a home in which to live safely every day by adding grab bars in the shower. The reality of aging in place is complex when ensuring a good quality of life for an individual with dementia living alone or for an older couple with a spouse with dementia. Earlier this week, our provincial government, in a press release announcing additional funding for the Better at Home program, said they were, and I quote, ensuring more seniors and elders, including those living rurally, will get the help they need with day-to-day tasks so they can continue staying in their own homes, which will reduce social isolation and strengthen community connections, end quote. As a person living with dementia, I do not understand their line of thinking. I fear the current aging in place movement is too simplistic. Aging with choice suggests a person has options. If staying in your own home is further isolating and your socialization needs are unable to be addressed, then you have options. Does everyone want to age in place? Perhaps. Is it in the best interest of everyone to do so? I think not. Research from the Alzheimer Society showed that 62% of people who live with dementia and live alone experience loneliness compared to 38% of all people with dementia. A contributing factor to this loneliness, I suggest, is the tendency for people with dementia to withdraw from socializing. Avoiding friends, family, and activities is a consequence for many. Yes, programs can be developed at the local community center or library, but they rely on individuals to be motivated and able to travel to the activity center, which is a challenge, especially for those living with dementia. An article last year from the Institute for Healthcare Policy and Innovation at the University of Michigan noted 88% of people between the ages of 50 and 80 said it was very or somewhat important to them that they live in their homes as long as possible. But only 15% said they've given a lot of consideration to how their home may need to be modified as they age, while 47% have given it little or no thought. Suggesting residents could or should rely on friends and family to assist them in some activities of daily living has, I think, limited applicability. My wife and I have lived in our townhouse for 29 years, and for us, I don't see this as a workable model. Likewise, for those who have children or other family members in their lives, many live and work in other parts of the country and indeed the world, which would make this reliance unreliable.
Oh, those are all really good points, Jim. And I guess what I was thinking as you were speaking was there's a difference between aging in place and aging in the right place. And the right place, going back to our earlier point, is really about that choice. I see that we've got a couple comments now in the chat box, and apologies if there were some troubles with that at the start. The chat box is active now, so please feel free to add your thoughts in there as we go. I'd like to continue on this thread and dive a little more into your personal experiences, Jim and Jana. And perhaps, Jim, I'll start with you. Drawing on your experience, what advice do you have for those who are new to the dementia journey when it comes to aging in the right place, not just aging in place?
Alice and I have lived in our townhouse, as I said, for 29 years. And knock on wood, there are more years yet to live here. That said, we are mindful of potential challenges that would force us to relocate. For that reason, we have in the last few years rid ourselves of things we no longer need or use. And now in the house, we have pretty much items we use regularly, which I hope is good planning. For our location, we are fortunate to be able to walk to the bank, for groceries, for coffee, to 2 community centers and to the bus stop. Part of this was good planning, but part of this was luck. For those newly diagnosed, I recommend learning what you can about living a meaningful life with dementia, and then take what you learned as you plan for the future, your future. What are you able to do now that may prove unsuitable or unavailable for you in the near future and in the long term? For example, driving. Is your home convenient for walking to a variety of stores and services? Would it be wise to learn about and become comfortable with using public transit? Will your home be suitable for a walker? I also suggest making yourself aware of technology and what it may offer. There are many and varied technologies available, from monitoring cameras to automatic shutoffs for the stove, to robots, and of course there's Alexa. Currently, some of the technologies being researched are, for me, a bit too intrusive. Becoming familiar with the various types of technologies, the benefits and barriers will give you confidence moving forward. You will also be able to gauge your own comfort level with the technology options. Believe me, I'm not trying to put the fear of God into anyone, but I am suggesting and hoping the person living with dementia will have a visioning type conversation of what ifs. What if I lose my license to drive? And what might I need in the short and the long term? As I said at the start, aging with choice requires a lot of forethought, self-reflection, and honesty.
Thanks, Jim. And there's a lot of good practical wisdom in what you've just shared there. And what I'm hearing too is the importance of having these discussions and thinking about these things early so that you're maximizing your opportunities for choice and for decision making. So thank you for that. Jana, I'd like to add a little bit onto your question. I do still want to hear about your personal experiences with aging with choice and how you've been supported. But I'd also like to hear what support you think is necessary for Indigenous peoples to allow for aging with choice.
Thank you, Jen. And I just want to thank Jim for, those great tips and reminders on what it is that we need to start doing earlier on. So thank you, Jim. So I want to kind of talk about, how I've been supported first, because the Indigenous one, I want to unpack that one a little bit more. But we've been very fortunate to have a great healthcare team. They've allowed us that space to vocalize any concerns or frustrations, any strengths, any successes, and support us in problem solving in a way that supports my dad's needs. And not only my dad's needs, but mine and my mom's as well. In addition to our healthcare team, I've utilized many of the resources and webinars that are available on the Alzheimer Society of B.C. website. Many of the resources available there help guide me through some of the challenges and allowed me to critically think about what services are working, what are not working, and what is missing. Some advice that I would like to give to other caregivers across the province, just from my journey, is learn about the disease, because knowledge is power. Find a support group that suits your needs and develop a circle of support for you and your loved one. Don't lose yourself in the caregiving journey, because you matter too. I found that the caregiving journey has been one of the most rewarding experiences despite all the grief and challenges. I have learned and grown so much, and I've become very self-aware through the process. I've become quite grateful, and I'm able to find meaning and joy in every single moment, no matter how small. Now, the question you asked that you added on there about what support is necessary for Indigenous peoples to enable aging with choice. So these are just my personal thoughts from experiences that I've encountered with being Indigenous. I spent a lot of time with this question, so I'm gonna try and do my best to summarize it. I want to thank you for asking it, first of all, and bringing attention to our Indigenous peoples and dementia. It is very personal for me, and it hits me in the heart. I believe that it is essential that anyone working in the healthcare system learn about the true history of Indigenous peoples in Canada, learn how that history might impact those that they serve. It takes more than just learning about the history, but also putting that knowledge into action when working with Indigenous peoples, starting from intake to service delivery to discharge, etc. For instance, how do the impacts of residential school system or intergenerational trauma influence responsive behaviors someone living with dementia might experience? How would someone living in long-term care be impacted when trauma exists? What strategies can be used to minimize harm to that person? Be preventative, not reactive. Behind every behavior is an unmet need. So trying to understand what needs might need to be met, or what actions create distress, we can hopefully minimize unintentional harms. I would love to see Indigenous specific supports in every sector of the healthcare system, including long-term care. Supports that are not pan-Indigenous, but rather distinctions-based. Being Métis, I've found that the majority of resources are primarily First Nations focused, and this isn't inclusive to Métis or Inuit. I tend to shut down accessing those resources and search for resources that take our unique history, experiences, and culture into account, indicating that those resources are culturally safe and centered. Building authentic and trusting relationships is also key. Sometimes it just takes sitting down and having a cup of tea with someone, learning their story, listening, and using active listening. And lastly, but again, there's so much more I would love to say about this, but I know that we're short on time. We need to create safe spaces, especially when providing personal care. Care that involves toileting, bathing, dressing, Often there are unrealistic and unreasonable time limits to providing such care, and this can leave room for extremely traumatic events to occur. Thank you.
Thank you, Jana, and I appreciate that there was a lot that we can cover and can't do it justice in this short panel discussion. So very much look forward to continuing these sorts of conversations because they're so important. And you've already highlighted some good, solid points for us to take away from that discussion. So thank you for that. I'm going to shift gears for the last question a bit. And this question is not only for our panelists, but also for our audience. So this is the part where if you have a response you'd like to share, I'd strongly encourage you to include it in the chat box, and we'll do our best to share some of the responses after we hear from our panelists. I'll start by setting the stage. We currently have a national dementia strategy. It was first released in 2019. Here in BC, we have the Provincial Guide to Dementia Care in British Columbia that was released in 2016, so about 6 years ago. We've gone through a period of profound disruption with the pandemic, and we can also see that there are significant demographic changes coming down the pike as our population ages. The landmark study that was released in September of last year highlights some of that follows on the heels of and has been followed by additional work, all saying the same thing. Taking all of that into consideration, from a dementia policy perspective, if you could make one change tomorrow, what would it be? And Jim, I'm going to start with you for this one.
And I turn my mute off. I would recommend to the provincial government that it was time to develop and release a provincial dementia strategy with a view of today's world, with proposed action items and accompanying metrics for tomorrow's world. Our world generally has changed in a multitude of ways since 2016, as it has with our knowledge about dementia and about living a positive and meaningful life with dementia. An up-to-date roadmap or vision for these next 5 or so years would be a reference guide for so many individuals and sectors. Researchers, medicine, and healthcare delivery would see the long view that could influence training modules of benefit to patients and families, as it would for those delivering person-focused healthcare in emergency departments, assisted living, and acute and long-term care. With consideration to aging in place, a strategy must include home care and home health considerations and delivery. Agencies offering these home services would then learn of the government's vision and delivery expectations for home care and home health, ensuring alignment of their services and, most importantly, identification of the need for any upgraded education plans for this workforce to be truly client-focused. For example, understanding clients with dementia and their unique needs vis-a-vis timing of appointments and the best approaches to the individual. While a provincial dementia strategy is broader than all the issues pertaining to aging in place, home and healthcare delivery, it is essential, as Dr. Catherine Begonis noted in her paper in the Journal of Aging and Environment, the need to keep in mind that aging in place is not a one-size-fits-all concept and does not necessarily contribute to well-being for all older adults.
Thank you for that, Jim. You've given us a lot to think and reflect on, and I would just be curious to follow up on your thoughts a little bit more with regards to those pieces. You mentioned the importance of seeing the continuum or the entire spectrum of services and support people need. If you took that one step further and you were thinking about beyond even just the healthcare system and the healthcare supports necessary to age well in a place of one's choice, what else would you put on your wish list?
I suspect the progress to technology and the integration of technology with living or living positively, and also the reality of research and the promotion of research in this province, especially when we have significant numbers of researchers with recognized skills, and I think those would bring it in. I'm going to say alignment. I'm not sure that that's the right word, but complementary, if you will, to the national dementia strategy, so that we can work together, and rather than this is the direction that BC is going to take, and it's going to be pulls apart from what is suggested in the national dementia strategy. As I say, I think the world has changed, and I think the world is going to continue really, really changing as it compared the world itself, but also related to people with dementia and the caregivers and the type of care that is offered and so on. And I think that being able to put so much of that into a document that would provide the situational document for today, but also of looking into the future and how to adapt and how we might adapt as a province and as the broader communities, I really do think is very important, as it is to put in the aspirations, but also including some metrics to measure, to make sure that what we're doing is right, and what was thought to be right at one point, the numbers are showing that it isn't right, or that we could do better. So let's do that and not wait for the end of the strategy to do that.
Thank you for that, Jim. And that's some words of wisdom there in terms of being able to both aligning with the work that's been done to date, but also looking at the role of metrics and how we evaluate our progress. So thank you. As you were speaking, I was thinking about the report that was released, I think about 3 days ago, Taking Back Healthcare, I think was the title of it. And one of the things that it referenced was that piece around data and the role of data ownership and how that can be a transformative factor for change, and similarly accountability. So thank you for raising that. Isobel, I'll ask you the same question, thinking about it from the context of strategy. If you could make a change, what would it be?
I think what we need to do is fully recognize how affordability is a bigger issue than I think we've recognized in the past. So like anything in life, your choices are not unlimited. There are many things that determine what choices you have to choose from. Where you live in the province is going to determine what choices you have. Where your family is and who your family is are going to determine to some extent what sort of array of choices you have. But how much money you have, frankly, is going to influence the choices available to you quite a bit, particularly as we age, and especially if we develop dementia. So when we talk about, getting the choice to live where we want to live, and Jim's right, it's not always at home that people want to choose. And we need to be very careful that we don't make people who want to live in an environment with other people somehow feel like they failed because they're not living alone. We have to be very careful about that. You know, people are different. Some people crave other people around them all the time, and some people crave nobody around them most of the time. And those don't change. But your ability to choose, if you're a renter in the West End of Vancouver and you want to go live in independent living or assisted living, you don't have the money to do that, probably. You don't have a house to sell to fund that. And what's available is limited. Care into the home. I've spoken about it before. I'll be speaking about it again in a few weeks, about the, when you talk about home care, Jim, the unaffordability of it for some people, not for all. So we need to recognize that. You know, the broad strokes around strategies and what we need to do, and governments need to do this. And governments, and this is every government everywhere, is very good at saying we do, and then the list follows. But when you get into it and have offices like mine take looks at, you realize, yeah, but it's not for everybody all the time. It's for some of the people some of the time. And really, we need to have a basic level that's offered to all of the people all of the time. And that, my worry is that sometimes we produce these strategies with very aspirational language, right? They aspire, and people get excited, and governments can say, we did this. But in the end, you sort of, well, what exactly, how is this playing out to the daughter whose dad is going downhill and who wants to support him, but has to go to work and has her own family, and dad's on GI? You get the idea. So I think that would be my goal, is that we better recognize the degree to which income and affordability is affecting what are actual healthcare choices for people in older years and people with dementia. They're not healthcare choices for me. Choice to have someone come and clean my house is not a healthcare choice. I can clean it myself. I may get to a point where I can't. It's then a healthcare choice. And that's the challenge that we have. So that would be my perspective.
That's a great point, Isobel. And as you were speaking, I was reflecting on Jana, your opening comments, you used the term equitable access, and how, to your point, Isobel, affordability intersects with that concept of equitable access, or how it doesn't. So I really appreciate your thoughts on that. I also note that we're getting some comments that are coming through the chat box, so I'll make sure that we have a little bit of time to get your guys' reaction to that. Jana, I'll ask you the same question. If you could make a change, what would it be?
Well, mine will be short, because pretty much Jim and Isobel answered. We're very aligned in that. I do feel that BC needs, you know, a strategy that is specific to our diverse population and our geographical needs. You know, so what our needs might be up here in the Kootenays might be different than somebody living in the coast, or even our neighbors, right? Our neighbors have different needs. So I think the federal or the national strategy is great, but we need to have something that, as Isobel said, you know, those broad brushstrokes, but that talks about the basic level of supports. You know, it's something that, like, that would be my goal, is that everyone has at least something that they can access, right, to make their quality of life, or to maintain a quality of life that is suitable, you know, to them, to keep them as healthy as they can, especially as we age. I mean, the numbers aren't going to be going down, right? They're increasing. So and I want to see action that allows our loved ones and us to truly experience aging with choice, and live in a way that is safe. So, you know, dignified, honors our beliefs, traditions, and values. So really, those things there are basic human rights, right? And so just ensuring that all services provide that. And again, Isobel and Jim kind of got everything I was going to say there, so I shortened it. But then that's good, because I see that there's questions coming up, so I don't want to take time away from them.
Well, thank you for that, Jana. And I loved how you drew the connection between what we're talking about and the concept of basic human rights, because that's come up in the conversation all the way through. Isobel, you mentioned it in your opening comments to that effect as well. So I really appreciate you raising that, Jana. And I'm going to go to some of the comments that we have here. Isobel, this one seems like it's tailor-made for you. One of the people who's on the call writes that they feel we're confronted by a double standard when the health system is working with those who have dementia. More financial support is needed for both the caregiver and the one with dementia. Wondering, when you think about that, your comments about affordability, what's your reaction to that or your comments on that?
Well, whether the person's experienced it, I'm not sure, or they know about it, but they certainly have hit the problem on the head there, which is some things are very, very unaffordable for people in British Columbia. So if we take it at a basic level, and people have heard me talk about this before, and they're going to hear me talk about it again, our home support services, we charge the most by a significant margin of any province in the country. Many charge nothing. So if you are a person whose spouse has dementia, for example, let's say your spouse's income is $29,000 a year. You've heard me talk about this before, and you want someone to come in the morning to get them up and going. We're going to charge you $9,000 a year for your public home support. Now, if you're on GIS, you don't pay that, but you know, you can be still low income, below minimum wage, and not be on GIS, and it carries on right across. Now, there's some things that are affordable. So adult day programs, for example, are very affordable for people. And unfortunately, we were making some progress on that until COVID hit. And we have not nearly rebounded on that the way we have on a lot of other things. But long-term care actually is affordable in British Columbia. It's affordable to everybody. The problem is it's more affordable for some people than independent living or assisted living is. And so, you know, you may want to be with other people. You may be at the point in your journey where you don't need long-term care, but that's your only option, because that's how we've constructed the affordability. And interestingly enough, British Columbia has more than double the number of people in long-term care with low care needs than they have in Alberta or Ontario. There's a linkage around this affordability issue, right? So yes, we do need to address that and to get the supports to people that they need. And we absolutely need to recognize the burden on these family members in terms of whether it's a spouse or an adult child in caring for their loved one, and better support we could give them to enable their loved one to live, to exercise their choices.
No, thank you for that, Isobel. I'm seeing some reactions in the comments here, and people resonating with what you've raised in the fact that how we've structured the co-pay system for home care, the way that we subsidize home care versus how we subsidize long-term care, means that at a point, long-term care becomes the more economical choice, as you've raised. So thank you for that. And there was another comment earlier about the importance of day programs, but also just funding and access for programs so people living with dementia can have fun and joy in their lives. And Jim, I know you've talked about this before, how important it is to have meaning and to recognize you can live a meaningful life. I'm curious to get your reaction to that statement there. Just around the importance of being able to have, you know, joy and connection in your life and be living with dementia.
There are just so many ways to have a meaningful life, and unfortunately for many, and I think there are so many, I don't want little points that where a person could realize they can have a meaningful life. When they're first diagnosed, perhaps by their family doctor, if they were given a hint that, you know, life does continue, you can do things, keep going, and but all the stories that I hear, they don't do that. And I'm not suggesting that they all, you know, say, go home and put your affairs in order and that's it. I'm not suggesting that. But I know so many people who have got the diagnosis, it's come out of left field, so it feels like a punch in the gut. So they go home, look at Google and see end of life and frail elderly, and don't get that positive reinforcement. And but finally they do, and through various means, and so then they do start telling people, they do start going out. But it is so important to find a reason to go out, to find a purpose. Or as my doctor used to say, you know, have a reason to get out of bed in the morning. Whether you volunteer or find a little role to play somewhere in the community. But I said, it is important to find your comfort level. I used to love going downtown. Having coffee, wandering around. I can't do that anymore. I get downtown and I'm so overwhelmed, I go back home. Translate likes me, but the coffee shops don't. It goes back to what all of us, Jana and I and Isobel have said. You learn about dementia and then learn about your capabilities, your desires, your need. But there is that need, and I emphasize the word need, to move forward.
So thank you for that, Jim, and reflecting on the way that you're describing it too, just the intersection between purpose, meaning, and choice, and how those three things are connected, and the factors around that influence the scope of our choices, whether it's affordability, whether it's access to services. I saw there was some comments around no challenges accessing certain community-based services, or even challenges accessing a diagnosis. Jana, kind of riffing off of some of the discussion that's showing up in the chat here, but you're outside of the Lower Mainland. You're out in Cranbrook. You have a different perspective when it comes to choice and the availability of choice from a rural perspective. What are your thoughts on that in terms of how the rural realities may differ when it comes to aging with choice?
Oh, well, I'm sure this is probably provincial wide, but things like the choice of, you know, first choice for long-term care, you know, the first choice bed. Well, if that's not available, then maybe you have to go to a different community, which is not sustainable for family members who work or don't drive, or, you know, to go visit. So then that isolation occurs. But I, you know, one of the things I was thinking about while Jim was talking there is, for those who can't go out on their own, like, you know, because as Jim was saying, different stages, or find out where you're at, you know, I something that came into my mind was hospice. So, you know, I want to put a shout out to hospice, because the worker that was involved with my dad and is still involved, he developed the programming for my dad's needs, not for what he thought my dad needed. It was for my dad's needs. And I got to tell you, that is the most invaluable thing, because living rurally somewhat, you know, we don't have access to a lot of services. We have some, and some, and most of them are excellent. But to just know that there's the trust, there's the relationship building. It was free. So again, we didn't have to worry about the cost. And to have somebody who took the time to find out what my dad's needs were, what my dad enjoyed. And then as my dad changed and the progression became more prevalent, they changed and how they did the things with my dad. So, if it was going for a walk, well, the walks became shorter or on more flat surface, and it was natural. And I commend that, because I think that's any human wants that, whether there's dementia or not, right? We want to be able to be treated with respect and dignity, and we want to feel heard and valued. And but in terms of the rural, I mean, it's accessibility to long-term care here. There's a long wait list, and our first choice bed wasn't the one that we got. However, that being said, my dad's in a really good place. And so, we kind of won the lottery there. And I'm very grateful to that. And but there's a shortage. There's a shortage of care aides. There's a shortage, in the long-term care. COVID's been going around. There's still outbreaks happening, so it's not gone, and that impacts as well in what we're able to do to support those living in long-term care.
Oh, it's so lovely to hear your experience with that, Jana. And as you were speaking, I was thinking that's the definition of person-centered care right there. That's lovely. And I'm seeing some people reacting to that in the comments. I want to pick up the thread on the long-term care piece, because I am seeing some comments in that regard. Isobel, this question will be for you, or rather a comment to you. One person was writing about how COVID has revealed major cracks in long-term care. I mean, Jana, you spoke to accessibility issues. Those predated the pandemic. We've seen it become more acute. The person's writing about the requirement for more accountability, research, funding. It's essential, and the conversations must continue. But Isobel, in your mind, what are the conversations we should be having around long-term care now?
Well, you may be surprised to hear me say this, but there are issues in long-term care. That is true, but that's not actually where the more serious issues or shortcomings are, quite frankly. When I talk about, if you look at the greatest number of people and their unmet needs, it really is about those supports in the community and the affordability of things like assisted living or independent living for the people who don't have it. Some of the challenges that we have in long-term care, first of all, frankly, some of them aren't fixable. Some of them are a reflection of living in a congregate setting and what that looks like. Others are more fixable. I think certainly around making sure you have the right number of staff and the right kind of staff. That's key. And in long-term care, we also have to be careful that we don't overcorrect. So when you, coming through loud and clear in the survey we did 5 years ago, and I predict in the survey we're doing now, the day-to-day life in the person in long-term care, it's not about a clinical experience. You don't go to long-term care to be fixed or cured. You go there to live your life, right? You go there to live your life, sometimes because you have high care needs, there's no other option, sometimes because, other people, all the rest of it. And we kind of have to be careful we don't lose that plot. So you would hear these stories around it all became about infection control, and, pictures got ripped off the walls and no Christmas concerts, and we sort of lost the plot here, right? When you talk to the people who live there, they don't talk about infection control. They talk about, I want someone to talk to who actually is interested in my opinion, not telling me what I should be doing or not doing. I want them to sit down and talk to me. I don't want to hear about how I should stop smoking. That ship sailed. I don't want to hear about how, I shouldn't have that chocolate bar. What, I might live 2 months less, right? That's what people want in long-term care. They want those people there that they can talk to, that are going to listen and be engaged with them. And we don't lose our ability to detect when somebody is really not interested in us. We know that when we talk to them at 35, and guess what? We know that when we talk to them at 85, right? So, you know, I think there are challenges there, but we have to make sure we're not overcorrecting and fixing the wrong things. The bigger issue is out there in the community, people with no supports. And how are we fixing? And why are some of these people in long-term care who both don't want to be there and don't need to be there? There's people who want to be there and need to be there. There always will be. It's the people who don't need to be there and don't want to be there that we need to be asking questions about. And that, I think, is a big part of the deficit we have in the community.
Thank you for that, Isobel. And
Yeah.
I love your point around it's people having the choice to live their lives in the way that they see fit, and that doesn't change even when you move into long-term care. So I appreciate that, and I'm seeing reactions to that extent in the comments as well. I'm going to turn us towards final comments because we're almost at the end of our time here. And so I'll go to each of our panelists. I think I see Jana's video is off, so hopefully the snowstorm hasn't got the better of her internet. But Jim, I'll start with you. Would love to get your final closing remarks on today's discussion.
Thank you. A year or two ago on Twitter, I was alerted to a short 2.5-minute video entitled "Please Answer," which was, for me, very powerful. The father in the video is a widower and presumably living in the family home, alone. He calls his adult child, leaves many messages, but never gets a call back. And one day he reports that he, quote, "didn't get out of bed today, didn't see much point," end quote. The filmmaker noted at the end of the video that 500,000 older people in the UK go without social contact for 6 days a week. I don't know any Canadian statistics. In the foreword for the text, "Life at Home for People with a Dementia" by Drs. Ruth Bartlett and Tula Branley, I wrote, "Am I completely sold on the idea of staying at home as long as possible? The jury is still out." Thank you.
Thank you for that, Jim. Isobel, I'm going to go to you next for your closing remarks.
Well, first of all, Jen, I want to thank you and the Alzheimer Society of B.C. for organizing this and for connecting us and for allowing people out there to share experiences from Jim and Jana particularly, because I think that will resonate with what they're experiencing. And to remember that, as Jim has said and as others have said, you know, dementia is a journey that looks very different for everybody. There is not this predictable trajectory. There is a difference of experience, and that really it is about supporting as best you can the person where they are in how they can exercise the choices that they have. And I hope that people come away from this with some hope and inspiration that, and I would say mostly from what Jim has said, that there is meaning in every day of life. Every day there needs to be a goal, whatever that goal may be. That goal may be getting up and getting dressed. That goal may be opening the curtains and at the beginning of the day and closing them at the end of the day. It doesn't matter. The goals may change. There may be fewer goals, but every day has purpose and meaning, and that doesn't change regardless of what diagnosis, of what ailment or illness you may have. And I think we are increasingly recognizing that, and increasingly through the work of of your organization, both provincially, nationally, and internationally, Jen, and advocates and voices like Jim coming forward, we are increasingly giving hope to people who receive a diagnosis that will be quite devastating for many. But I am hopeful that things are improving and will continue to improve.
Thank you for that, Isobel. Two words there that really struck me: hope and purpose. Those are two very powerful concepts, and to your point, very powerful in terms of how we live our lives too. So thank you for that. Jana, I'm going to go to you now for closing remarks.
Thanks, Jen. I'm going to leave my camera off because I keep getting the alert that my internet connection is unstable. But I too want to thank the Society for inviting me to be a part of this panel and for recognizing the importance of starting dialogue about supports for Indigenous people, that allow aging with choice. Thank you to all who have asked questions, made comments. I've been reading the chat, and it's such a wide range of different experiences. As Isobel said, there's no trajectory, there's no, it's unique. So for each person, there are similarities, yes, but uniqueness. And it's, as a caregiver, I'm truly, truly blessed with the supports that I've had and the encouragement from the society and even Jim, meeting him was a huge blessing in my life. So I feel incredibly honored to be speaking alongside Jim. His voice and passion are truly creating pathways of change for others in the province and the country. He's a blessing to us all. So Jim, my hands, you can't see me, but my hands are up to you. You've definitely impacted my life in a very positive way. And I think it's important to look at those moments as meaningful and have that hope. And, there's going to be challenges. Yes, there's going to be roadblocks and there's going to be stumbles, but we have that throughout life. So, we can still find meaning in everything that we do. Isobel, it was wonderful hearing and learning from you. And I look really forward to meeting you when you're in person in the Kootenays in the next couple of weeks. And I hope that the snow is at least not coming down as hard as it is today. But, Jen, thank you. And thank you for your support and, through this, and to the society for, especially for Alzheimer's Awareness Month. I recognize the hard work that has gone into that and, bringing that awareness out. And it has been remarkable. So my hands go up to all of you. Thank you so much. Much love.
Thank you, Jana. My heart is full right now. So my sincere thanks to our panelists, Jim, Isobel, Jana. I've been watching the chat as well. There's some wonderful feedback and reactions coming through this. This is a great conversation to be having and an important one to continue to be having. Just a few things to bring us home as we wrap for today. If you have a question or concern that hasn't been addressed, I'd encourage you to email advocacy@alzheimerbc.org. So that's advocacy@alzheimerbc.org to share your stories and experiences. And I'd like to briefly pass the mic over to Amy McCallion, Chair of the Alzheimer Society of BC's Board of Directors, for closing remarks. Amy, over to you.
Thanks, Jen. I'm getting that internet instability message as well, so hopefully everyone can hear me okay. Well, Jen, I'll just start by thanking you for being such a great moderator today. Excellent work. And I'd also like to thank Isobel Mackenzie, Jana Schulz, and Jim Mann for taking part in today's event. I learned so much just from listening to the three of you share different perspectives. Thank you. Thank you so much to each and every one of you for joining us for this important discussion that many people across the province are having. We hope you've learned something from the discussion today. And if you'd like to learn more about Alzheimer's Awareness Month, visit the Society's website at www.alzheimer'sBC.org. You can also always call the First Link Dementia Helpline for information and support. So thank you again from everyone at the Alzheimer Society of BC.